It's a state-by-state process, and certainly the work of the NIH Institute for Integrative and Complementary Health, that's been renamed as of 2016, after years of research that the NIH had put forth to really determine what is alternative, what's integrative care. And so that those types of decisions that are quite public and quite visible drive the need for reimbursement and drive each state to look at licensing and the billing requirements with licensing. So in New York State, licensing or billing is in place. I can't speak to other states right now, but it's a united front of many forces, right? Not only the efficacy of research that shows efficacy, but governing bodies like the Institute. They changed their name from Institute for Alternative and Complementary Health to Integrative and Complementary Health because what they found after their research, years of research, was that people were not using therapies like music therapy alternative to mainstream medicine, but in addition to or integrative to, and it warranted a change of name, which was quite huge for the NIH to do that.
State by state, we see licensure coming in to the picture, and that really helps reimbursement. In particular, reimbursement at the edges of life, so in neonatal care and in the aging brain, where we haven't really found the tip of a cure for dementia, and our brains are aging. So we're looking for strategies that work in the moment. And boy, if you look at the literature in the past 3 years on neurologic music therapy and live music therapy in stroke, in rhythmicity, in Alzheimer's, there's a clear surge, and not just in the music therapy journals, but in journals like Neuron and Science Academy journals and Science and Nature, and it's exploding.
I think apropos that, coming year after year, the messaging that seems to come through is familiarity and accessibility to music therapy is the issue, and I think that will improve when licensing and reimbursement is developed state by state. But physicians, year after year, that's part of the narrative of the presentations, is that those two things, lack of familiarity and accessibility.
Pain is one medical definition, maybe one of the only ones in Tabor's medical dictionary that includes an emotional response. So whether it's a physical ailment causing the pain, or a trauma, or mental incidents, if you will, that evokes the pain response, we know in both those circumstances that there's an emotional response. And music therapy can really forge that bridge into connecting the mind with the body and the body with the mind. Since the beginning of time, since drumming in the Bible, we see Saul and David with the harp. It's an age-old folklore to use music in healing, but to bring it to a scientific level has really spread the depth and understanding of music therapy and pain.